Hello. Now I want to introduce our spinal rejuvenation therapy program. One of the first things we do in our office, we have patients do, is drink water. We want them to hydrate. And the thing is that most people are dehydrated. You're walking around dehydrated. They're not getting enough water into their system. And I can tell when patients come in they're dehydrated because their tissues are really hard. The muscles are spasming. They're tight. They're spasming. Extremely hard, especially in the neck, upper back area, and even the lower back. Some of you may feel that hard, real dense tissue. That's because you're not hydrated enough. You need to drink plenty of water. And there's a really simple formula you do to determine how much water you should drink. You take your body weight in pounds and you divide that by 2. And those are the number of ounces of water you should drink each and every day. So for example, if you're 200 pounds, divide that by 2, that's 100 ounces of water you should drink each and every day. Most people do not drink enough water. So the very first thing we have you do in our office is we have you do a shot of what's called our Celtic sea salt. A Celtic sea salt has 84 trace minerals in it, and what it does is it helps the nerve system work better, helps the immune system, your digestive tract. It just helps replenish a lot of the minerals that you're missing from your diet. So we pour a little bit of this in there. Rebecca here is my assistant. She's going to take a little shot of that. Then we trace it and follow it up with 8 ounces of water. So I have her do 8 ounces of water before she does anything in the office. So we make sure you're hydrated. It's very important that you drink plenty of water, lots of water in our office. You see, and there's 2 different types of tissue. There's red tissue and white tissue. Red tissue is like muscles, okay? And muscles have a direct blood supply to them, okay, to bring nutrients to the muscles, and then they eliminate the waste products. So the muscles have a direct blood supply. White tissues do not. White tissues are like discs, the disc spaces, your ligaments, your tendons, cartilage. They do not have a direct blood supply to them. So it's important that you get motions. They get movement, and motion is what brings nutrients to the disc, ligaments, and tendons. So we have to get motion and movement that will pump nutrients into those areas there. A few examples of that we're going to go over now and show you how we do a wobble chair and our cervical traction. That's how we get motion into the spine.